Hey everybody, welcome to the Mother Figures podcast. I'm Caitlin Darkangelo, founder and co-owner of Figure, Midwestern wife, and girl mom. I'm a dual certified pregnancy and postpartum trainer, majored in exercise science from the University of Michigan, earned my master in management degree from Duke University, and have been coaching in the fitness industry for over a decade. This podcast dives into all things pregnancy and postpartum fitness, especially in how to navigate strength and intensity training in these seasons. Whether you're in it yourself, trying to get pregnant, or coaching this population, you're in the right place. I'm excited to share personal experiences, client stories, guest interviews, and evidence-based strategies to give you the guidance, insights, and clarity needed to navigate these seasons with confidence. And with that, let's get rolling. Hey everybody, and welcome back to the Mother Figures podcast. Today I am going to go into Breech and External Cephalic version because on today's Wednesday, Friday, I found out at our 36-week appointment that my baby was Breech, and then just yesterday I had my External Cephalic version, and I pretty much just wanted to do this podcast right after it so I can get all of my thoughts out right away and kind of give you guys a firsthand experience from it. And then just also kind of go into literally the whole weekend. I was just like digging into so much research and asking the doctors and the midwives and all my professionals in my network about it and things like that. So this is going to be a combination podcast of like research and professional opinions and my personal experience and things that other moms have told me about their experience. So just a smorgasbord of information about Breech and ECV. But obviously I'm going to tie my own personal experience into this, and I'll try to remind you guys when it's my personal experience versus like what research is saying, because obviously I'm an individual and individuals have different experiences. So giving you both ends of the spectrum. So first, when it comes to Breech babies, that's when the baby's head is up instead of down. So you want the head to be closer to the pelvis. So the head is the first thing that comes out when you deliver the baby. This happens in 3 to 4% of full-term pregnancies. So pregnancies that are 37 weeks or later. So it's actually pretty rare. I thought it was more than that, but apparently not. So at 28 weeks, it's about 25% of babies are breech, so it's still kind of early to tell. At that 32 week point, 7% of babies are breech, so that's kind of when you start to get a feeling if it's going to stay breech or not. And then at that 36, 37 week is when it becomes like you are breech or you have a breech baby at full term. So for me, at my 32-week appointment, she was like, oh, like it looks like the baby's head might be up, but it wasn't in ultrasound at that point. It was just them checking the heart rate. So it was just a guess, and it kind of felt a little bit like the head was up. And then I've been seeing so many different professionals like pelvic floor therapists, Webster chiropractics, prenatal massage, even my midwives at my other appointments in between that 32-week point and my 36-week. They all were like, oh, yep, that feels like baby's head is down. Even when they took the heartbeat, it was low. So it was interesting that at one point, at the 32-week point, like I was given the recommendation or given the sense that she's probably up, but then every point in between then of professionals kind of feeling around and stuff, they're like, oh yeah, it feels like she's probably down. So that was interesting. However, I also could feel I could feel her head, but I just thought it was her butt. And looking back, I'm like, oh my gosh, that's like for sure, like obviously her head. It was a very defined circle. You can actually see it in some pictures that I took. And I would feel like these kicking jabs down into like my bladder, like that lightning crotch feeling, but it was like super direct. And I don't remember experiencing either of those with Amelia, like that specific defined circle at the top or those like really hard jabs low. And so looking back, I'm like, I should have had a little bit, like I had an intuition, but I just kept being told that it wasn't Breech. So I'm like, so looking back, I'm like, there were some signs that she was head up. So that's just from my personal experience. I was physically able to see a hard circle, and then you could like knowing now, like it was smaller than like what your hips or what the baby's hips would be, and then that those like jabbing downward feelings that was different. Those are pretty clear signs. So breech affects 3 to 4% of full-term babies, so babies after that 37-week point. And there's different types of breech positions or variations. There's complete, so that's when the baby is like tucked like in a pretzel. They're like crisscross applesauce pretty much and just kind of in a ball. Then there's frank breech, which is when both legs are straight up. So like the legs are towards the head, like kind of like a pike position or like a forward fold essentially. And then there's incomplete breech, which is like kind of a combo, like one knee might be tucked, one leg might be long. There's a different combination of straight and bent. And then there's also transverse breech, where it's like the baby is like going side to side. So different variations that can, be breech. My baby ended up being in that tucked pretzel configuration, that complete breech. And I'll go into some of these things in a little bit here, but it may have a small impact of success of different things. So regardless, anyways, I also dug into like what causes breech predispositions, or like what are some potential factors. And although for the most part it's like unknown, it just like can happen, there's some theories or some potential causes that may or may not cause breech. One is the shape of a mom's uterus, amniotic fluid, placenta previa, if the baby is premature. There could be fetal neuromuscular disorders that affects how the baby can move, and so it's not able to move down. Research or like different places have quoted, in general, things that either affect fetal motility or like how well the baby can move, and then vertical polarity of the uterine cavity, which pretty much just means like things affecting where the baby can move to. There's nothing you can do to reduce your chance of having a breech baby. And most of the time it's just like random. But those are things that have been shown that could potentially cause a higher predisposition to having a breech baby. Again, I am no scientist. I'm no expert in this field, but over my weekend of stressing and trying to figure out any information on breech that I could, this is kind of research that I've fallen on. So when a baby is breech, generally you're given a few options. Like, so for me, we went in, saw that the baby was breech, and my midwife immediately recommended ECV, or External Cephalic version, which is going to be the entire part 2 of this podcast. So I'll save all the details of that there. But essentially, they manually try to manipulate the baby to go head down. Number 2, some moms just go straight to C-section without attempting an ECV. And then some plan to go into labor with a known breech and then also skip the ECV. But in all 3 considerations, generally the mom will do certain things to try to get the baby to flip naturally. And so I posted an Instagram reel this week, and you guys were so helpful with it. I had moms and chiropractors and acupuncturists and massage therapists and midwives and doulas all like kind of commenting too on like different things to try to get your baby to flip. And from all of those posts, it kind of boiled down into these big categories. One was acupuncture. Again, I don't know the science and the stuff behind it, but there's pressure points and acupuncture points that can help stimulate the uterus or blood flow and all this kind of stuff. Another one was moxibustion. I did not go deep into this, but this has something to do with like there's a point on your pinky toes, I believe, that if you either use acupuncture on that, or it's like, or you light a fire of I'm gonna totally butcher this, so just look it up on your own. But it like stimulates something that goes into your like a bladder area, bladder 67 space in your uterine cavity that helps to stimulate baby movement or something. Literally, don't quote me on this. Just look it up. Moxibustion. That was one thing that was highly recommended. I personally did not try, but it's out there. Webster Chiropractic. I actually had my Webster Chiro appointment an hour before I went to my midwife, where I saw that she was breech. And then I have some other appointments already scheduled with her. So that was something I was currently doing anyways. And then she was breech. But so that was one thing too. Really highly recommended chiropractor in general. Another one was the spinning babies technique. So it's like a combination or series of different movements that can help get baby to get more comfortable or get into a better position. So a lot of things like inversions, asymmetrical walking, just different positions, like exercises that your body can go through. So spinning babies was another one that was highly recommended. And then some other just random ones that people have said is putting cold things at the top of your belly and then warm things at the bottom to entice the baby to get away from the cold and closer to the warm at the bottom. So that has helped some moms help the baby flip. Just generally resting, just chilling out and trying to relax. Breath work. Some have said like in the pool, they were doing like front flips in the pool or just like getting the belly like in this free float stage to allow the baby to find some different positions to go into. So these are all things that were either recommended to me by other moms who have been in the breech situation or from different professionals. And my midwife actually mentioned most of these as well in our appointment as ways to try to naturally flip the baby. Another cool thing that I have experienced is, although breech only happens in 3 to 4% of full-term pregnancies, I had an insane amount of moms say that they had breech babies and like just different things or like their experiences. And it's just cool, like when you talk about stuff that's less common, like how many moms come out of the woodworks and like I'm like, yeah, like I did this and I did this. It's like the mom community is really cool in sharing and helping each other. So I just wanted to throw that in there too, which was very helpful for me as I was stressing the whole 5 days before my procedure. So in general, about 94% of breech babies at term are born via C-section, so which means about 6% of babies are born vaginally breech. There are some risks associated with going into labor breech. This is highly controversial. There was a study in 2000 called the Term Breech Trials that kind of laid a nasty foundation for vaginal breech, but now they're finding that there was a lot of like issues with how the study was conducted. So that's not a point of this podcast, but regardless, that kind of started the higher rates of C-section. Fewer doctors became trained in it. So it's a little bit harder to find doctors who want to do breech vaginal deliveries. So that's one of the risks going in, is like there's less doctors to help out. Research has also shown that there's like a relatively higher risk of perinatal mortality or like fetal death or morbidity, which is like other health outcomes. Versus it was higher in the vaginal groups versus the C-section. So there is slightly higher relative risks there. And then there's also risk of like umbilical cord or like getting the head stuck, fetal injuries with like on the way out. So you can kind of look into risks and weigh them on, your own. So that is something to consider, and just wanted to kind of throw that in there. And I'm not, again, an expert on breech, just those are some considerations when it comes to risks with vaginal breech births. So in my situation, when my baby was showing breech, midwife recommended external cephalic version. I said, let's try to do it. So that was Friday. And then my ECV was scheduled for Tuesday. So I tried some of those breech flipping techniques within those few days. Did not work. So then I went into the procedure. They made sure that she was still breech. And then we kind of had all this stuff that I will now kind of discuss on the external cephalic version side of things. My throat is getting dry. So ECV, what it is, it's externally midwives and doctors trying to flip, which is the version piece of it, baby head down or into cephalic version. So externally flipping baby down. It pretty much has a 50-50 shot of working. So that's one reason why some moms choose to decline it. If you are kind of on the 50% it's going to fail side, why try it? I was on the 50%. We have a good shot. So I went to. I guess there's also a higher chance if it's not your first kid. So the uterus is like more primed or like it's been stretched already. So there's a potential better chance of second time moms, third time moms having it be successful. Some other things that have been shown to increase ECV rates is also if the baby is not yet engaged in the pelvis. So if the baby's higher up, essentially, if the this one was interesting, if the care provider can easily feel the baby's head on palpitation, which is related to the baby's position as well as the maternal body fat. So that made me feel kind of good because one, we could feel where the baby's head was at, but also like since they were able to feel it because there wasn't as much like fat layer on top, like they were able to more accurately know how to turn it essentially. So those are strongly linked to higher HCV rates. Number one, having given birth to children before, if the baby is not engaged, and if you can feel the baby's head with lower maternal body fat. And then other factors that increase likelihood of success, but like to a lesser extent, that have been quoted. A lot of these are like studies from Lim and Lucero 2017 study. One is if the placenta is posterior, which mine was. If the birthing person's BMI is like a lower than 32.7, so lower BMI in general. If there's normal levels of amniotic fluid, if the waters are still intact, so before your waters break, if you have a normally shaped uterus, if the abdominal wall muscles are relaxed, and if it's a non-frank breech presentation, which this one was the first time I had heard that the type of breech could potentially affect the outcome of an ECV. So my baby was complete breech, so non-frank, which maybe helped me or not. I don't know. So those are some more like just what an ECV is. And now I'm just going to kind of go through my specific scenario because that just happened yesterday. So it's nice and fresh in my brain right now. And yeah, so I also asked like a shit ton of questions to like the doc when we were going through it. So I just wanted to kind of reiterate things that I had learned from her point of view, as well as my own personal experience of it. So again, like I said, at the 36-week appointment, found out she was breech. That was on Friday. Other providers kind of said she might have been down or up or whatever. So it was at the 36-week appointment when they were doing the ultrasound to check baby position when they were able to confirm. And so I thought that was interesting because like there's really no for sure way to tell if a baby is breech unless you get that ultrasound. And so maybe I should have like asked for one earlier. I don't even know if you could or if it wouldn't have even mattered because they wouldn't have done the ECV until 37 weeks. But regardless, so she gave the option for ECV. I took it and then was scheduled for Tuesday morning. Some suggested that I push the ECV back to give myself a little bit more time to turn her naturally. But the reason they do it at 37 is because 1 year full term officially. So if something does emergent happen with the baby, then you can have the baby born at full term still. But then also the further you delay, the bigger the baby gets. So the more comfy they get in their spot and the harder it essentially is to flip them. So I opted to keep it at Tuesday, even though it only gave me like 3 days to try to flip her and kind of learn all my options and stuff. I just felt like that was a better option for me, given higher success rates earlier on in that full term window. So that's something else to consider. That's why they do it at 37 weeks. They probably wouldn't have done it prior to because baby wouldn't have been full term. So the whole weekend I was, doing all the researching, asking everybody all their opinions, trying different exercises. People said that you would probably feel if she flipped, like it's a very big feeling when they go from up to down or down to up, but I did not feel that at all. So, and she did not flip. Again, I had my chiropractor appointment an hour before that, so that was already taken care of. I actually had a prenatal massage scheduled for Sunday already. Did both of those. Obviously, the baby did not flip. And then when we went in Tuesday, this is kind of like the process of what an ECV is or looks like. At least where I'm at, maybe it's different at different hospitals, but in general. So appointment was scheduled for 9:00. You had to be there an hour and a half early. And then during those 1.5 hours, they did an initial ultrasound first to just make sure that she was still head up, because if she had gone head down, none of this would be needed. So they first go in, do an initial ultrasound. Then they took blood. They put those like fetal heart rate monitors on my belly to get like the heartbeat and everything. Got into a hospital gown, threw the IV in. I opted for getting the IV in my hand because one thing I wanted to change for labor was like they put it in my elbow last time, like the crease of my elbow, and that sucked. And that was one thing I wanted to finish or to like fix this time around. So the hand ended up being a better spot for me. So I'm kind of glad from that perspective that I got the experience of having the IV where I think I wanted it for labor. But regardless, they had me fast for 8 hours minimum prior to the appointment, because they make it as if you were going to go into a C-section or a surgery, just in case. They actually make sure that there is an operating room available, and I'll talk about this in a second too, just in case there is an emergency. So it's done in triage or in I guess sometimes you get straight put into an operating room just in case. That wasn't my situation. But so anyways, we got into triage, but we had to make sure that there was an OR room primed and ready. So that's why they make you fast. That made me lightheaded when I got the blood drawn. I'm not a great needles person, so that was like kind of queasy, kind of went black for a second, but never passed out. But had to get it like a wet cold towel on my forehead. But regardless, and then I got any questions answered during that 1.5 hours prior to the procedure. And then also that is when I selected a pain route. So the 3 options they gave me were 1, the nitric gas, 2, an epidural, and 3, nothing. And a few things went into my decision. I ended up choosing to do the nitric gas, when you put like the mask over your face, and it's kind of like the laughy gas that you get at the doctor's or the dentist. So a few things that went into my decision for pain, relief during this procedure. One is, I guess most people pick epidural. Depends on the hospital. Like my midwife said that about 60% of people choose to have an epidural during this procedure, 40% don't. I have one of my clients who is a nurse and said that she's never really had somebody reject the epidural at their place. So it varies widely, but most people, I guess, do choose to do the epidural. Regardless, first thing that went into my decision is that second-time moms generally have a higher success rate. So I felt that I might not need an epidural if the process could be potentially smoother or quicker. So that was just one minor thing. 2, I kind of weirdly and psychotically wanted to feel like what most of it felt like, just so I could have a comparison to my natural or unmedicated labor with Amelia. I was just curious, like I wanted to feel what the difference was. Very weird, but whatever. 3 is I was interested in using nitric gas for labor this time around because one of my things is I want more pain relief. And so I wanted to kind of use this as my test of like if it helped me or like what it was like and kind of get comfortable with using it. 4, I naturally lean on the less medications, more natural side of things anyways. And nitric gas doesn't pass the placenta or take pain away or block receptors. It just kind of gets the mind loopy enough to not have as much of that like sting. So it kind of like just dulls pain from a mental perspective. And then right when you take the gas off, like your body doesn't like keep it in your system. It just kind of goes away. And then 5, like I mentioned, like one of my priorities for labor was like more pain relief or, better management of it in order to have a better experience during and right after. So I just wanted to have some kind of pain relief versus not using anything. So I was kind of like weighing my odds between like not using anything and nitric gas, but then knowing that my goal for labor this time is more pain management, I wanted to kind of hold true to that here too, and just like give myself more relief if I have the option for it. The one thing that was hard in rejecting the epidural was knowing that in like a worst case scenario, if there was fetal distress and they had to really quickly get me into a C-section, they would have had to knock me out for the birth, and that would have really stunk. Like I didn't want that situation to happen. However, it's super low chance that would happen, and so I kind of weighed that against all of my other things. And so for me personally, that's why I chose the nitric gas. So after kind of that hour and a half prep time, choosing the options and going through and the midwives were actually really great in telling me all of these risks and relative risks, and just, if you choose this might this can be, an issue or whatever. Like they were really good on helping me with that decision-making process. So just making sure that if this does happen to you, just ask them questions, and hopefully you'll have providers that kind of help you weigh risks and relative rewards. So I'm all set up at this point. It's 9:00. We've been there for an hour and a half with the IV in and my fetal monitor and all this stuff. And then they come in and they're like, the operating room got taken by a mom going into a C-section. And so we're going to have to delay you an hour and a half. And I'm like, are you kidding me? So my first reaction was like, oh, I have to sit here with all these things in my arms, and like I have to just like delay this like omniscient, like what the heck is this process like, and is it like, I don't know, it just added to the anticipation. Then I was like, okay, it kind of sucks for that mom who's going into emergency C-section, so I should have some relief for her. So anyways, I had to wait an hour and a half, added a lot of a suspense and just unneeded anticipation to it. So then an hour and a half later, nurses come in, and I'm like, oh God, here we go. So in general, in my situation, I had a nurse who was watching the monitor. I had the doctor who was doing the procedure itself. I had my midwife. I go to a practice that has like 14 of them on rotation. So the one from my practice was there with the ultrasound in her hand to monitor the baby positioning. And then there was also a midwife in the room who had never seen one before. So she was just kind of watching. So in general, like 2 people are active and then 1 person's like watching. They did another ultrasound to start just to make sure she was still head up, obviously, and to see the type of breech and to see the exact baby positioning. So that's when they found that she was in that curled up, complete breech position. Her back was to my back, so she was like kind of sunny side up. I also asked them to see my placenta placement based on some of the research that I had gone through and wanted to just see where it was. It is posterior, so that was good. And I also asked them if they could tell if the umbilical cord was near or wrapped around her neck, because umbilical cord is like one of those pieces that could play into success rates and baby fetal responsiveness. And we also actually had one of my husband's clients' wives who they went in to do an ECV, and they had to get rushed into an emergency C-section because the cord was wrapped around. So because we knew somebody personally that had that happen to, I just wanted to like see if they could check just in case, maybe give me some more like, just awareness of what could potentially happen at that point. But they did not see the placenta, or they did not see the umbilical cord anywhere near the neck. It was hard to see. Like they say, they don't traditionally check because it's harder to see where the umbilical cord is. But regardless, it's something that I had to ask for. So if that's something that you need to ask for, like don't be afraid. They'll just go in and kind of try to find it. So once they did the ultrasound to check all that positioning and things, they gave me a shot in my arm. I'm going to butcher this name. It's like terbutaline or something. It helps to relax the uterus so it doesn't contract during the procedure. And that was done like immediately. They said it makes your heart kind of fluttery or like make you feel jittery, but I started the gas like a minute after that shot went in. So I can't say that I felt any of the effects of the uterus medication. I can't forget what what it was called. But that's something that they also do. And then they gave me the gas mask and they told me to take like big deep breaths and to nod when I felt the effects starting to kick in. So they don't start the procedure until like for the nitric gas situation, until it kind of starts to kick up. And so at that point, it took me about a minute because I wasn't doing big enough deep breaths. But then it kind of like started to kick in. So then I nodded and then they started the procedure. So generally the doctor and the midwife or two doctors or whatever combination of two people would take all four hands and manually from the outside move the baby into bottom position. But this doctor, for whatever reason, always has preferred to do it by herself. So it was just her two hands. I didn't know this at the time. I thought all four were on me. I could not even tell. But so I guess it also depends on the doctor, like kind of the process that she does. And in general, it sounds like if the baby is going to move, it'll move on the first few tries one way. If it doesn't on those first few tries, then they'll try it the opposite way. And then they'll call it quits if like nothing. So there's like, they kind of told me this going in. So when they started, I was like, okay, this is like trial number one. Based on her position, they said they might try a forward roll or a backward roll because she was back to me and then they could like roll her forward. But they ended up going in a counterclockwise rotation as their like initial starting point. And so then they kind of started and went that way. This was my biggest curiosity going into ECV, like what it felt like or how much pain I was going to be in. And not many people could describe it to me. And now I kind of understand why. So I'm going to use my best. I still don't really have the words to describe it, but I'm going to, from my point of view or like my situation, I don't really know how to describe it, but here we go. So I'm laying on my back. I have one hand grabbing Anthony's hand. I have the other hand on the gas mask holding it to my face. And so she goes in with your hands and like, again, I can't tell you where the hands actually exactly were, but it was like an immediate excruciating pain as if someone's trying to like purposely twist your organs in your stomach. It was as severe and intense as like active labor or like the height of labor pains, but it wasn't. So with labor, it like takes a long time. You kind of like build up and you have pains building up to it. This one, it was like you don't feel anything before, obviously. And then right when they start, it just goes to like level 100. And then right when it ends, you feel nothing. So it's like this very, very sharp, intense, like someone's twisting your organs. Like I was just like clenching the crap out of Anthony's hands. Afterwards, he goes, wow, I think I had a more painful time because your nails were digging so hard into my hand. I'm like, oh my gosh, F off. So he felt the grasp of my grip on him. And I was like, so like, I just remember just trying to like stay as calm as I could, which is where the nitric gas came in. And that I could not recommend anymore. It was amazing. Doing it without it would be pretty dang tough. Obviously, I would just have to do it. Like I would have done it anyways. But it was a lot. So it wasn't like labor cramps because it wasn't low in the pelvis. It wasn't like how labor is kind of like a whole body experience. It was a very, it was obviously only in the belly. So it was more restricted in where the pain was. And the midwife before was like, oh, it'll just feel very uncomfortable. And I'm just trying to be candid with you guys. Like it was more than uncomfortable. Like that is a very mild word to use for that situation. And I also learned afterwards that like the midwife told me that was the most gentle one that the doctor has ever done. Like normally she is a lot more rough. And I was like, what in the world? Like how can you even get any deeper? Pretty much. But because of the nitric gas, I felt like it was almost like an out of body experience. Like my brain just like blacked out a little bit. I don't know if it was blackout because the pain or blackout because of the nitric gas. I don't really care which one it was. But it helped me. Like I was kind of like out of my brain, and I remember thinking within this whole process only took 1 minute. So it was successful. It took a minute. It was like the best case scenario. And this was still just my experience again. But during it, I remember being able to tell myself like, just relax your body. And like, so I remember physically feeling like my core muscles, like letting go, letting my legs kind of go more limp versus like just stiff arming, like stiff legging really my whole body. So like the nitric gas definitely did help mentally take my brain out of it for a second, enough to at least stay somewhat involved with the process. But essentially like she like lifts the baby from underneath up and then like physically rotates her all the way to like sideways and then all the way down until the head goes down. So it's just a really weird, I kind of felt her twist, but again, it was like such a heightened, like intense situation that like I can't specify specific points in time within that minute, but I kind of felt her move, I guess, all the way down. I mean, I definitely was feeling her move because that's what the pain was, but like where she was at anatomically, I guess I couldn't really tell you. But regardless, within that process that took about 45 seconds to a minute, they said that there was 2 attempts within that time frame. And Anthony actually mentioned too right after, he was like, yeah, they like kind of pushed, and then the midwife did the ultrasound to see where she was, and then they pushed again, and then that's when she kind of like locked into head down, so it was successful. So it felt like one continuous flip. But regardless, so that was that was kind of crazy. I guess it can take up to like 30 minutes of attempts. To be able to do that for 30 minutes straight, I don't think any human being could endure that for 30 minutes without a break. But so they would like do it and take a break, do it and take a break. Most doctors, or pretty much everybody, would try maybe 2 or 3 times in each direction. And if the baby's not budging, it's not going to happen, is kind of what they what they say. So I could handle the minute. I would say it was like, compared to natural birth, like unmedicated birth, that was like a 10 out of 10 pain. This was like I would call it like a 7 or an 8 out of 10 for that minute. But it also only took a minute and then it was done, and I felt no residual feeling afterwards. Like it felt like as if nothing happened. Like I took my gas mask off and I was like, holy crap, like I'm so happy she slipped. Like it was immediately like fine. So it was just like a different situation. So that's how my words are forming right now of like what it actually feels like. So it's not to scare you, but like I wish more people had like words or like ways to describe it, but now I'm kind of understanding why it's so hard to experience. It was just like an out of body, weird, otherworldly situation. But anyways, if I had to do that like 6 to 10 attempts of that 1 minute stretch, like that would get intense. And now I see like why, some moms opt for an epidural. The nitric gas, I still would have taken that over the epidural, because it was so fast, one, but also I feel like it was manageable enough with the nitric gas. So that was just my personal experience. She did say, or I guess the heart rate, going back, baby's heart rate for me, like, did not accelerate. It did not decelerate. It stayed totally normal. So she was happy, totally fine. That's not always the case. The doctor that I had said that she's only had one time in 10 years that they had an emergency C-section from the baby's heart rate decelerating or accelerating and like staying there. She did say most of the time, or more, not more often than not, but like pretty commonly, they will see like fetal distress in some way, but then it'll kind of level off after a minute or two. So if the baby's heart rate does change, it's not always a concern. They just see how it's, changes after the process is done. So anyways, that was the whole like actual process of it. And then they make you stay for about 30 to 60 minutes to monitor you afterwards, or monitor the fetal movement afterwards, and make sure that you're all good there. And when I was waiting during that time, I started contracting. So it was like very mild period cramps, like not enough to like I was still like laughing, and like they weren't like labor prep or labor pains essentially. But on the monitor next to us, like every 4 to 5 minutes, I would have like a contraction, and I was like, oh my gosh, what if I go into labor right now? And prior to going in, one of the research studies I found was for successful ECVs, about 20 to 25% of those moms will go into natural labor within 48 hours after the procedure. So I'm like, oh my gosh, like what if we're getting into labor here? But they kind of stalled out once I started moving around, and I haven't felt any. That was now 24 hours ago or so. So I haven't felt anything from there, but I guess we're still in that 40-hour window. So we'll see. But it was also kind of cool because immediately when she started moving again, I could immediately feel like the feet kicking to the ribs. I felt different low movements that I haven't felt. And even today, it's just been funny to like, I feel like my belly is different shape because there's no more like head at the top. That's more of that bulge, different movement patterns. It's just kind of a funny, like, oh yeah, this is like more of what Amelia felt like. Like now it makes so much sense. Or it's more clear to me now that how obvious it was that she was breech, and just looking back, the signs that would have told me that. So anyways, they discharged me, told me to monitor for obvious things like, going into active labor, like labor contractions, bleeding, water breaking, decreased fetal movement. And then I asked about like movement or exercise restrictions or limitations. She advised against things like handstands, inversions, upside down yoga poses, just because, although I've also seen from like research in other places that it can't really, if you have a head down baby, inversions just kind of help baby come out of that position and come down back into like comfortable position. So I don't know per se if inversions would or would not flip her back up, but I am not about to try to test that theory. I have felt more like mentally on edge today, like any like bigger movement, or like I'm just more like mentally conscious for no good reason at all of like bending forward. I'm like, I do not want this baby to get out of this position, like stay right where you're at. And so even though there's like nothing to back that up, it's just like a mental thing of like, I don't want to go through that again, and I want to just be able to go into natural labor. And I don't care if I sound ridiculous. I don't want anything to accidentally flip this baby back. I actually looked that piece up too, and only about 2 to 5% of babies will flip back to head up after a successful version. So very low risk of that, but still, I'm like, I do not want to be. I was already a part of the 3 to 4% of breech babies, so I'm not about to be 2 to 5% of the flipping back to breech after this point. So I'm a little bit more mentally cautious per se, with no good reason besides it's just how your mom brain works, I guess sometimes. But anyways, they encourage weightlifting, movement, like all the things. There's no restrictions after the procedure. So I haven't felt any contractions since then. Now I'm just kind of like waiting until little girl wants to push me into labor. I do feel sore today. Like I have some, like, it feels like bruising around the outside of my belly where they were like pushing her around. There's no physical bruising. There is like some broken blood vessels on the outsides around my belly, which is kind of crazy. Very minor ones, very small, but still. But it just feels like, like someone like did what they did. They grabbed the baby and like physically forcefully pushed her down. So I'm kind of having a little bit of residual pain from that today, but not anything like, not unless I touch it, I can kind of feel like, oh yeah, something definitely happened there yesterday. So, that was my whole experience yesterday with that procedure. 10 out of 10 would do it again. Obviously, it went super successful for me. It was very smooth. It took one try, 1 minute. It can obviously be harder than that for a lot of scenarios. It's a 50-50 shot if it works. So I think that plays into my good feelings about it as well. So you'll find a very, very wide range of opinions and experiences about ECVs based on people's results from them. Again, the pain was a lot, but it was it was tolerable enough to do it, and it was worth it. It was obviously very painful. I'm not going to sugarcoat that piece, but that was kind of my situation. And now here I am at 37 and 2, and now we'll just wait for a baby to come, and hopefully things go smooth the rest of these weeks. So kind of a crazy past few days. Wanted to get this all recorded on podcast form because there's no way I would be able to fit this on like a 3-minute Instagram reel. So hopefully this helps either prepare you or just give you another side of late pregnancy that can maybe help you if you come into this situation yourself, or maybe you're kind of where I'm at right now currently, and maybe it can give you some insight or things to look into going into either an ECV or breech birth or whatever it may be. So with that, I will see you guys on the next episode. Thanks for tuning in to the Mother Figures podcast. If these episodes help or resonate with you in any way, it would be so helpful to the show if you could leave a review so we can get this into more moms' hands. And if you're looking for even more guidance and direction when it comes to pregnancy and postpartum fitness, I got you covered. My Mother Figures app subscription includes my Figure Pregnancy and Figure Postpartum workout programs, in addition to our general fitness programs. You'll get the day-by-day workouts you need to help you feel strong, pain-free, and labor-ready during pregnancy, and also the recovery, strength, and progressions you'll need to get back to the activities you love, full of strength and without symptoms after baby arrives. If you're local to the Brighton, Michigan area, I also host daily women's functional fitness classes, a 6-week postpartum return to fitness course, and pregnancy and postpartum consultation sessions. For those who are providers, coaches, or practitioners in the space, I hold a live Mother Figures certification course that equips you with the knowledge, tools, and confidence to train and work with this population. For information on all of these services and programs, make sure to check out fitisgettingreal.com/moms or head to the show notes for the direct link. I'm so thankful that you tuned in today's episode, and I will catch you next time.